I just wanted to say hello and welcome to everybody. For those of you who don't know me, I'm registered dietitian and head of content here at Nutrition Network. I'm Tamsin Murphy, and today I'm joined by none other than Dr. Hassina Kajee, an integrative physician and medical director here at Nutrition Network. And today we are giving you a sneak peek into our new professional training called Cardiovascular Health, which is launching this coming Wednesday, the 27th of August. That's Wednesday next week. So sign up now to get a 30% off early bird special, which runs only until Wednesday. But our topic today specifically is around stress and your heart. Is stress really bad for the heart? What does stress do inside the body? How do you spot it when stress becomes harmful in yourself or in your patients? And what simple steps can you take to help mitigate the stress's deleterious effects on your heart health? So let's dive right in. Welcome, Dr. Kajee. Thank you so much for being here.
Thank you so much, Tamsin. And I think this is such an incredibly overlooked topic that I'm really excited to talk about. And thank you to everybody watching. I hope that this will get you interested in our module because it is jam-packed with information.
Absolutely. So I want to let all of you know, please comment in the comment section. Say hello, say where you're from, ask your questions. This is a really great opportunity to find out more about the topic when we have such an amazing expert right here in front of us. I will be watching the comment section and the comment box. So let's start, Dr. Kajee, with why stress matters for the heart, because we all think of stress as just being in our head, right? We're like, oh, I'm so stressed right now. Everything at work is so hectic. Or, I'm so stressed right now. I'm having a fight with my husband. Or I'm so stressed right now. The kids have got such a bad attitude. I've got too much on my plate. So we think of it like as a more, we're referring to the psychological impact, anxiety, the feeling of overwhelm. But stress doesn't just affect, we don't just feel it in our brains, right? It actually affects our heart and our blood vessels. Can you start by just telling us about when you first came to realize the severe impact of stress on the heart or on the cardiovascular system? How did you realize this?
So, I think it is a combination of working in an environment where, being patient on the ground, patient facing, seeing so many people being admitted with cardiovascular disease, and then just looking around at my colleagues at work. It was a very personal sort of discovery. My own realization of experiencing my own burnout, I think, was the biggest learning moment, because I was somebody I'm thankfully very robust in terms of my immune system, and I never got the flu. And suddenly I was a mother of two working in the emergency unit with really amazing colleagues that I respect. And it was shocking how frequently I was getting sick. And that was the first trigger, because I had normalized my own level of stress so much. The woman who can, the woman who can do everything. You can have the kids, you can have the career, you can specialize, you can even work in the bloody emergency unit, and suddenly I wasn't invincible. And I felt terrible because I felt like my body was failing me. So it was getting bugs. Obviously, in the emergency unit, you are completely surrounded by a variety of bugs. But not only me, my amazing colleagues, this one was, when you were sick, we ended up wearing masks in the tea room around each other. And it was just, as I got deeper and deeper and deeper and closer to burnout, I realized I eventually developed, I didn't realize this was going to become a personal story, but I realized that I actually developed pneumonia. And guess what? I went to work with that pneumonia. I had a whiteout on my lungs. And because we didn't have people to cover the department, I dragged myself to a hospital and realized just how wrong it was. So it was that rang the bell. looking at all my other colleagues in the various departments, and how people were like basically dropping like flies, for want of a better term. And it hit me, this normalization of stress, it cannot be seen more in the medical environment.
Mm.
And I realized there's way more to it, and that's when I started the journey of just it just took me. And yes, we're eating well and exercising and sleeping, but this in my own patient population seems to be the thing that is most difficult to get a handle on.
Yeah, absolutely. And I think what you say about stress being normalized, I mean, I think yours is a really, really hectic example, stress on steroids. But I
Mm-hmm.
think in the modern day and age, it is almost respected to be Superman or Superwoman. It's looked down on if you're not doing everything, looking after the kids and the house and sleeping enough and if you're in our space, sleeping enough, exercising enough, eating correctly, and still excelling within your profession. And there is so much pressure, that next thing you start finding symptoms like
Mm-hmm.
for you and your colleagues, it was first immunological symptoms. And I'd like our audience all to look back at times when they have had to study for a really, really big exam, or they've had something really, really big, they've done it. Or let's say you get to the end of your studying term, and then you go on holiday. What happens? You get
Mm-hmm.
sick. You get sick every single time, especially if you're someone who takes your life and your work really seriously. And that just it's a sign. It's the first sign I think we can mention about stress. And then the next sign, which you've mentioned or touched on, which I think we can dive in a little bit more detail, is burnout. Now, there must
Mm-hmm.
have been signs and symptoms leading to that diagnosis of burnout, Dr. Kajee, before you actually got there. What are those, other than getting sick all the time? What are some other
Mm-hmm.
signs and symptoms that you saw within yourself or have seen within your patients that frequently come up before you would say you have complete burnout, or you have a heart attack, or you have something really
Mm-hmm.
big happen? What are these little niggling signs of stress?
So, the first thing is your personality starts to shift a little bit, but it's almost imperceptible. You don't know that you've changed. So, you start noticing, if you're lucky enough to have a relationship with your partner or with your family, where they feel free to speak gently, you will hear, are you okay? You don't sound like yourself anymore. You're snapping a little bit. You're so irritable, or you're working way into the night. So for me, it was kind of a good and a bad stress, because it was me standing in the emergency unit facing all of these chronic illnesses hopelessly, and then at the same time finding out about low carb, and reading up on every piece of literature I could get my hand on, working into the night, being on call 1 in 4 or 1 in 5. I was saying to my husband, I was breastfeeding while on call. So I would get a call while breastfeeding my son, through the night, because I needed to do it all. No way am I going to let my son go on formula because I want to work. And even though dad was at home, but it was trying to burn the candle at both ends, establishing a low carb clinic for my patients, and also realizing, it was all of that, not getting
Mm,
enough sleep. So you don't know if you're irritable because you're not getting enough sleep. And what you said earlier, Tamsin, is so important. You said, and I mentioned it in my talk, that we wear it as a badge of honor. This stress. I'm so stressed, right? That's why I really appreciate people. I interviewed Nadia Pataguana this week, and she speaks in her interview about how she took a sabbatical away from work because she realized that she's a mother first, and she needed to look after her family, after some things came up in the family. And that was the step that I took away from, academic medicine, knowing that my entire life but realizing I wasn't really stepping away, I was stepping into nutrition science because I knew that was not the way. So really, it's the irritability. It's no longer having that zest and the passion. So you lose who you are. You're no longer that excited. You're not excited about going to work anymore. You don't want to do the things that you used to do. You don't want to hang out with your friends. It's a chore. Excessive tiredness, fatigue, exhaustion. So sleeping and it's not enough to get you revitalized. These are all not early signs, they're late signs. You know, um, we we don't really have a good handle on when to pick up those signs early. But I really feel like when you're feeling the overwhelm, and it's more than just 1 day a week, 2 days a week, and it's starting to eat into your zest for life, the things you love doing become like, oh, my child's asking me to play with him again, and oh my goodness, who am I love playing with this child. Why you know it's early recognition. Yeah, it's a tough one because we're surrounded by examples of how not to do it.
Yeah, wow, that's so powerful. And I think so many members of our audience can identify with exactly what you're describing. I certainly know that I can,
Mhm.
where you start to either go to bed late because you have to work late or you wake up early. So in my case, I will wake up at about 4 in the morning. And when
Mhm.
that pattern starts, because I need to work or because I feel like something's on my mind, I need to get it done. When that starts going like, okay, there's something not right. So I think, and the irritability and the change of personality. And if you have people close enough to you who can kindly point that out to you, you could even say, I'm feeling really stressed. How are you experiencing me? Those kind of things. And I did want to echo what Kieran says, Dr. Kajee. He says
Mhm.
that you gave some of the most enjoyable lectures on the coach practitioner training recently. And clearly,
Oh,
you've done a
thank you.
fantastic job of looking within yourself to enable you to better help others. If only the
Oh, thank
system
you so
could
much.
manifest such empathy.
Oh,
Um,
thank you so much for that. I really feel like you were saying, Tamsin, realizing and saying, I feel. I don't think we have normalized I feel. If
mhm,
we look back to, and this is no blame on parents, if we look back to the generation we come from, and then to the generation that raised them, it was sort of a post-war generation raising the next generation. And the generation that raised us didn't necessarily say, how do you feel? How are you feeling? We were, depending on what background we come from, we were encouraged to pursue our dreams and, never take no for an answer, all in our best interests. And so we maybe don't have the skills to
mm,
have that self empathy and that self compassion. And
yeah.
I think self compassion is the correct term. And I speak about this in my talk, that it really starts with the self. When you feel that it's okay to sacrifice yourself first for the thing, how is that okay? How is it that sleep, yes, now and then you have no control over sleep, like when your child wakes up vomiting in the middle of the night or something like that, or when you're sick, or if you're traveling. But why is it the norm that the sleep goes? Why is that pillar of my health something I so easily am able to sacrifice? Why is it that I don't have the vocabulary to say, I feel overwhelmed? Why is
Mm,
that not okay? Why is it that when you get an email to say, can you please do this? Oh, sure. And then you have a partner who looks at you and goes, are you sure you have space to take that on? So I think it is this type of self conversation that we need to start normalizing. We need to
mm,
speak about it. There's so much shame around acopia. I remember having a very, very respected mentor and colleague, and we had a young doctor come into the emergency unit, and she could not cope with the levels of stress. And it was in various departments that she had faced it. And I remember him saying, she just shouldn't be a doctor then, because she's just not cut out for it. And I looked at him and I said, is anyone cut out for this? Is anyone cut out to see? And I know I'm talking about extreme
Mm,
situations that many of our listeners won't resonate with, but I think the doctors will resonate with this, or this would resonate with them. We're not meant to, in the South African setting, be seeing the insides of people due to one on one violence. You know, we're not meant to be dealing with so much trauma, but we quiet the voice that says, you know, you, if you can numb yourself, you're strong. And it is those environments that become really toxic.
mm,
You know, the boss that has no boundaries and is mailing you after 6 p.m., and you don't feel strong enough to say, boundary, this is my private home time. Can you then have that conversation to say, we need to be able to have, this is a, you know, a boundary that I'm not willing to break. So really, I feel that it starts at home. It starts with our
mm.
children. We need to be teaching our children boundaries and when to say, I'm uncomfortable, I don't feel okay. Mom, this is too much. Mom, I need a mental health day from school. You know, we need to have a balance.
Absolutely. And it starts with compassion with ourselves. And as you say, we come from a generation where you're absolutely pushed and wonderfully so encouraged to pursue your dreams, to become the best you can be. But alongside that comes often a suppression of emotion or, oh, just sweep that under the carpet. You don't really feel like that, just, suck it up. And I do
Mhm.
think that there's been too much of that, and I do think it's resulted, combined with the fast pace and exposure to all the global horrors and everything else, it just compounds so that we end up with such a stressed psyche. But let's move on from that, and we can always come back to it and look at what this means for our hearts.
Mm.
How can the psychological stress, this feeling of overwhelm, which, okay, maybe can suppress our immune system, and we can talk about that with cortisol. And we know that, people are given cortisone, which is a synthetic form of cortisol, or originally an animal form of cortisol,
Mhm.
to actually suppress your inflammation, to suppress your immune system, and our bodies create that. So sure, we can suppress our immune system, that's bad, and then we can start having personality changes, not sleeping enough. But how does it affect our heart, Dr. Kajee?
So, Tamsin, this is such a huge science. It has been so thoroughly investigated that it is may very well be called causative. Stress may be called a causative factor because the odds ratio of certain types of stress exceeds smoking, it exceeds hypertension. So, what happens there, and I describe this in my talk in great detail. What I've done is I've first gone into the pathophysiology as hypothesized by Malcolm Hendrick, as hypothesized by Nadir Ali in our ketogenic textbook, and so well explained, and as accepted globally by cardiologists that inflammation is a key factor in coronary artery disease. And I go to show the various mechanisms in coronary artery disease, you know, the pathophysiology. Now, when it comes to stress, stress stimulates the very same pathways. Not only does it activate the immune system, what does that mean when it activates the immune system? It's not just immune suppression chronically, it is also immune activation. So it is a switching on of the immune system to say that there is drama, there's trauma, there is attack, and those cells are recruited to areas that need repair. Now, remember, the first step is that catecholamine storm that you get, the cortisol, the noradrenaline, and that results chronically. We have mechanisms in our body to temper, for example, blood pressure spikes. We have carotid sinus nodules that we call baroreceptors. They detect changes in pressure within our blood, within our blood flow. And when they realize that the pressure is going up, they modulate the system to reduce the blood pressure. But over a period of time, those systems become desensitized. Those receptors no longer work. So, can you imagine how crazy that is? That suddenly you've got a blood pressure surge with nothing to bring it down. No nitric oxide vasodilation, none of that, no renin, angiotensin, aldosterone system to set the processes to reduce that blood pressure. So, when you have a situation where you have chronic stress, you create these blood pressure surges, you create vasoconstriction within your vessels, you activate the immune system. What's happening underneath the surface is that there is, if this is the wall of the blood vessel, you're creating shear stress against that blood vessel. So you're denuding the endothelium, the glycocalyx, similar to what Dr. Malcolm Kendrick talks about in the pathophysiology of cardiovascular disease. And so when you have this, and then the immune system is activated, and then platelets are activated to become sticky, to travel to that area where the immune cells go and lodge and call for help and say, here's the damage, come here. And then the platelets track and they get under there. At the same time, you've got blood pressure surges happening. If you've got a plaque, we know that a coronary artery event is not just stenosis, that the vessel is blocked and it's calcium. It is when that plaque ruptures. What is going to cause a plaque? Here's a blood vessel. Here's a little plaque sitting there. Suddenly, whoosh, blood pressure surge. It causes shear stress that chops off the head of that plaque. All of the fibrin and fat and everything within that pours out. That's an additional mechanism to activate the immune system. Come in, clot it up. And that is what happens when you eventually have that. But all of this takes time. We're not having, yes, there are things like Takotsubo cardiomyopathy, which is a catecholamine storm that happens when there is acute stress. This is something that I've actually seen. It's not that rare that you don't see. I've had probably 3 patients in my career in the emergency unit with people coming in, maybe more, with what we call Takotsubo. They come in heart failure, no prior medical illness, maybe a young lady, maybe an older person. They cannot breathe. Their lungs are full of water. They have pulmonary edema. Their blood pressure is high. They're experiencing chest pain. You do the ECG, they look like they're having a heart attack with heart failure. You sort them out, send them to the cath lab. Cath lab comes back, clear coronary arteries. This is most likely Takotsubo. It is from an acute storm, an emotional event so perceived by them to be so great that their body releases all of these chemicals that have that impact on the heart, because there is a brain heart network directly from the brain to the heart and then from the heart back to the brain. And this is what is involved acutely in these rare cases. So think about, if that happens because their trauma was too high, or their perception of the trauma was that it was that high, what is happening chronically underneath the surface? This has been proven. These pathologies have been proven. There's epidemiological studies to show that this may very well be causative factors for cardiovascular disease.
Wow, Dr. Kajee, what I'm thinking of when you tell a story is, the stories of often elderly couples. When one dies, they say the other died a few days or a month later of heartbreak. Is
Yes,
this
yes.
the same thing, what you're describing?
I think it's related. Takotsubo is so overwhelming and such an emergency that it's actually called broken heart syndrome. Takotsubo is called broken heart syndrome. And the cases that I've seen clinically and read about are this storm of events. So they cannot breathe. You can't stay home for that. You have to be brought to the emergency unit. You need oxygen. You need all the therapies. But like you say, the broken heart syndrome of people who lose a child and then the husband dies a few weeks later because he couldn't cope with these are all mechanisms that are directly linked to brain and heart. The studies show that those people who have long-standing depression, anxiety, post-traumatic stress disorder are all at the highest risk of developing coronary artery disease.
Wow. So let's talk a little bit about acute versus chronic, short term versus long term, because you acknowledge that it's often years and years and years of compounded damage caused by chronic stress over time that then results in this buildup where eventually you have this breaking off of the plaque under high blood pressure because already the plaque is built up to that extent due to years of damage potentially. But then you talk about this acute stressor, which can similarly cause heart failure. Can you tell us a little bit about, is acute worse? Is chronic worse? What's the interaction? What's going on there? Because now I'm in two minds about which is worse.
Yeah, so funny enough, chronic is worse. Acute has an excellent prognosis. So all of these patients that I've seen completely they're expected to get their cardiac function normal. So we have a term in medicine called the ejection fraction when it comes to the contractility of the heart, and we want a certain level to be normal ejection fraction. And often what you will see with these patients with Takotsubo is that they come in and they are lower ejection fraction, maybe their heart. So instead of the heart, like we explained to patients, instead of your heart beating with 5 fingers, your heart is beating with 2 fingers. And with the support and the treatment, the heart is able to remodel. The heart has this amazing ability for cardiac remodeling so that the areas that have undergone this ischemia regain their, they regain their mitochondria, are just back to normal again, and they're able to completely, full functionality, full ejection fraction. Whereas when it comes to the chronic stressors, one thing I speak about is the role of the mitochondria. And we know in this audience how much we value mitochondria. We're trying to do everything to keep our mitochondria healthy and our telomeres long. But stress modifies the function of the mitochondria in that the, like I explained in the talk, like a chicken that's stressed is not going to give you eggs. Like a mother that's stressed is not going to give you, is going to find it quite difficult to fall pregnant. It's just not the natural way things go. In the same way, the mitochondria that is stressed is not going to be putting out adequate amounts of ATP. In addition, the mitochondria changes its shape. It dies. It's going through fission, fusion abnormalities. It changes the shape of its architecture. So in short, it's dysfunctional, and it leads to epigenetic changes that are heritable. So these changes that we have in our body, in our mitochondria, we transmit to our children, who transmit to their children. And it causes telomere shortening. So, you're aging quicker with stress. You can see that in the mirror when you go through a stressful period, the lines that a person gets on their face, the complexion that changes, they look older, the graying. I laugh because I got my first gray hair 2 months after I had my daughter, and I looked at and we have a history of going gray later in our family. And I looked at myself in the mirror and I was like, she gave me my first gray hair. And it was that happy stress because you're awake through the night, but it was still stressful on the body. So you see this, and we see it. It's something that we completely ignore. People going through a lot of stress go gray. Children go gray. Children going through a war or a genocide, or young people are turning gray. I've seen this in my own colleagues over time. That graying is an aging of the body. It's a longevity pathway that got hit, and it's a sign of, it's like an end organ effect, or whether you've got on your beard or your hair, of stress and the body not handling it well. So there's so many different pathways that are chronically activated. The blood pressure, that the baroreceptors that no longer function, the immune system, the activation of the platelet, the whole coagulation cascade that's activated, the deposition of the plaque within your blood vessels, the changes that are happening in the endothelium. So of course, the effects of chronic stress are way worse, but they can, there are things. It is a modifiable risk factor. There's something we can do about it, and that I think is more important.
So we'll definitely get to that. I think that's very important. And I do just want to take this opportunity to mention Dr. Manjunath Markandaya does an amazing lecture within this course, and we've interviewed him live before. So go back into our repository of lives and please listen to him. But in his lecture within this cardiovascular health training, he speaks about heart failure and he speaks about remodeling of of congestive cardiac failure of the heart muscle to actually go from an LVAD, which is basically a pump that makes your heart work when it's so badly failed, to be able to work on its own again. So it's a huge amount of cardiac remodeling that, previously we thought was very, very unlikely if wouldn't happen at all. And now we're seeing that with the correct and appropriate treatment, including things like ketones and things like that, but he goes into it a lot more detail, we can encourage cardiac remodeling. And that is exceptional and so exciting. So definitely, if you're interested in this, also please refer to that. We also have David Renaud, who's an amazing French researcher in the space of heart failure and neonatal abnormalities in the heart. He also goes into more depth into this topic. So really, if you take this training, you're going to get to investigate all of these mechanisms, all of these kind of things that you can do to do absolutely exceptional things with your patients or with your own heart in this training. So please, we can't cover it all in these lives as much as we would love to. So please go ahead and sign up for that training. Okay, so back to the crux of things. Before we move on to kind of what we can do about these kind of things, and maybe a bit more of your experience clinically, Dr. Kajee, I just want to wrap up all the mechanisms, because there's one thing that's still kind of niggling at the back of my head. You've mentioned the raise in blood pressure from the catecholamine cascade, the stress hormones that raise our blood pressure, and we can't get it down because we don't have, the nitric oxide and everything else to bring it down. And then you also mentioned, the inflammatory process, the thrombotic process, where you're having all the immune system rushing to the endothelial lining where it's damaged, and then you're having plaque buildup, and then you're having plaque rupture, and then you're having further inflammation, and you're having stenosis, and you're having blockage, and all of that. Okay, so that I get. But there is something that seems to come up with stress that maybe you can explain to me and our audience, which is heart rhythm disturbances. Because with stress, a lot of people say, oh, my heart just was beating out of my chest, right? And it goes beyond that. You start getting people who say they have constant heart fluctuations, they're missing beats, or these arrhythmias or rhythm disturbances. What is going on there, and should we be worried, and how does that connect to stress?
I'm so glad that you've asked that question, Tamsin. So firstly, there's a distinction between somebody experiencing acute stress, an anxiety disorder, or panic episode, where they feel like their heart is beating out of their chest. That is the catecholamine storm. That is basically your sympathetic nervous system, that your foot is too much on the petrol and the brake doesn't work. So you're racing down the road. What does that do? That there is, as I mentioned, a direct link between the heart. There's a neural network between the heart and the brain, which there must be, because we don't think to beat. It beats automatically. It's an autonomic nervous system that's it's under control of the autonomic nervous system. And so we have the SA node. If you think about those who are in the medical field will know, but basically that is your pacemaker, and that's the thing that tells your heart to beat, 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 and that is under control of your body, your thoughts, your environment, so that when your eyes or your ears or your senses pick up something scary, and often in chronic stress it's a scary thought. I have to finish, I have a deadline, I'm running late, oh, my child is screaming, it's a thought, but it could be various senses that pick it up. That neural pathway, that activation of the nervous system, then goes straight down to the SA node to say, beat faster to accomplish the task or the goal. And as we said, under normal circumstances, that is fine, normal. We want that. We want our heart to beat faster when we need it. We want to be able to run up, run away, save ourselves. However, what has been found is that when there is exhaustion of the system, when there is overwhelm, when there is a chronic foot on the pedal, that creates within the heart something called an arrhythmogenic substrate, right? An arrhythmogenic substrate is an area within the heart that becomes irritable. It is an area that is now at high risk of arrhythmias. So, this is not when somebody's having a panic attack, they're not having an arrhythmia, they're going through the normal channels, the normal wiring of the heart, they're just beating faster. But what is not well recognized is that stress is directly responsible for an arrhythmogenic substrate to develop within the heart that puts the person at risk of taking over the pacemaker activity of the heart. Within the heart, the thing that beats the fastest is king. So our SA node, which sets the metronome, it sets the tone, is king. When it beats, the heart listens to it. It is the ringmaster, right? When there is an arrhythmogenic substrate that is now under stress, substrate, it just means that it's at risk of taking over. Depending on where in the heart it is, it will take over the beating of the heart. So if it is higher than the SA node or somewhere within that, depending on how irritable it becomes, it starts to become the metronome. So that metronome is not a regular metronome. It may not be regular. Instead of beating at 60, whatever, 70 beats a minute, 80, 100, 120, it's suddenly going at 300. And then there are systems within the heart to block some and let some through, block some, let some through. But what will happen is that the person will feel this perception of the heart beating out of the chest. And, this can be what we call a supraventricular tachycardia. It can be a ventricular tachycardia, ventricular, not necessarily, it could even be a ventricular fibrillation that is more likely in ischemic hearts. But it could be, depending on where it is, it's a little bit complicated to talk about this, but or to explain this, but it really just depends on where in the heart it is. And those are the people that end up, they have to go and see the cardiologist or a rhythm specialist, have mapping done of the heart, find out where that focus is, and then the cardiologist or the electrophysiologist has to now do all of the hard work to burn that area, to ablate it. We call it ablation. But what was shocking to me was finding out the role of stress in development of that arrhythmogenic substrate, because in medical teaching, we know, I was taught that everybody will get an arrhythmia if they live long enough. Everybody will get atrial fibrillation. It's just one of those things. It's the norm. But now when you think about, could stress be responsible for those arrhythmias? It's shocking. So these are the things that have made me stop and pause and be more mindful about keeping my heart rate down, in the day to day.
Wow. So my understanding from what you've just said is that the SA node will generally be the ringmaster and, keep your heart ticking at a relatively constant, rate. But then with this new substrate, it doesn't sound like it's always in control. Is it more when there's a catecholamine storm or a cascade where suddenly we're having a lot of stress hormone release that it then speeds up? Or is it always in control?
I don't think there's enough information on that. An arrhythmogenic substrate is really just something that takes over, that has a potential to take over. And so, the way I've experienced it in patients is that a person will say, I was at home and I suddenly felt my heart beating really fast. And then we'll give them a desk and say, tap it out for me. How did it feel? Did it go like, or did it go? And then we would try to, because it happens for short periods of time and it bursts. I mean, and some of it's different types of syndromes, like we have Wolff Parkinson White syndrome, where they're actual neural abnormalities. So this may be young people. So this would be a different thing, not related to stress. But the field of arrhythmias is so wide that and there's so few electrophysiologists in the world anyway, that my understanding of it is just that it's diagnosed and then ablated and then watched. Some people may need to wear a device in order to shock the heart out of it. Lifelong they would have to wear that. If the ablation fails, many people have multiple ablations because it's not something that can be easily treated, because it's now scar tissue in the heart. So really, whenever there is tissue in the heart that has been primed, that is no longer functioning as regular pacemaker, the way the whole heart works is, the charge comes and then all of the cells fall in line to contract. And then the new charge comes and then all of the cells. And if they're not doing that, then they're always going to be at risk of taking over. So anything that stimulates them, coffee may push them into an arrhythmia. Exercise, pushing up your heart rate, any kind of mental stress, all of those things could stimulate it.
Wow. So Dr. Kajee, we haven't got that much time left, and I think we've still got the crux of the discussion to have, which is what can we do about this? Okay, so I see Kieran in the chat box is saying, do you think that a well-formulated low-carb diet can help reverse such a substrate?
So I think it can help, because we are if you're going to compare, the standard American diet to a well-formulated ketogenic diet or low carb diet, we know that one stands head and shoulders above the other in terms of the stimulation of insulin, the stimulation of inflammation, the just sort of the neutralization, the better mitochondria. So definitely a better diet is better at now, I don't want all of you to go out and go to a cardiologist and say that I think I have arrhythmogenic substrate, because this is not very common. Yes, arrhythmias as you get older are common, but not all of them. If you go to it's just a question that you and your doctor should be asking: how much stress is there in your life? What kind of life have you had? Have you had a lot of stress? We don't have those discussions. Like I have had those discussions prior to all of this and my low carb journey and knowledge with younger children, with people coming in, but it has been more of a kind of a subliminal clue to talk about it, because you can perceive them. We have categories of patients, as you know, Tamsin. There are people that get more autoimmune diseases who fit into a different criteria of people who don't speak, the people who self-neglecting personalities, who don't speak up and always trying to people pleasers. We have those types of personalities that you see, and you can recognize when someone's under undue pressure. Being in this field where we see people for a living, you learn more, you learn about people, you learn communication is about 70 to 80% nonverbal. So you can get those cues and talk about them. But when it comes to diet, yes, in short, it does help. But as you saw, or as I spoke about, and if you watch my talk, you will see just the stress as a standalone factor, regardless of whether you have a genetic predisposition or all of those things, is in itself is so severe a risk that it may not even matter.
So that's a big statement. I feel like, especially in our space at Nutrition Network, we talk a lot about nutrition, obviously, or it wouldn't be in our name. But the truth is, I think what we're highlighting here is that nutrition isn't the be all and end all. It cannot fix absolutely everything. There are so many other pillars of health that we need to consider and that are equally crucial. So maybe we can now talk about that, Dr. Kajee, before it's time to go. What are the things that the audience, who might be lay people, but they also might be clinicians, should be thinking about doing to mitigate or reduce the stress induced damage to the heart and the cardiovascular system?
So, Tamsin, we can talk about this from what's been studied and proven and published, and we can talk about it from in terms of practical aspects, like what I've experienced in my profession, what I have found to work personally. But I'll start with the publications. And so we know that when it comes to mental health, in general, the old story, and I am not against this or speaking down on it, but the old story is cognitive behavioral therapy. So basically, talk therapy, that you or someone recognizes that you're not well, you're going through illness. It definitely has a role. But what the studies are showing is that mindfulness based therapies, there's a meta analysis that I share that looked at all of the different work done in this and found that mindfulness based therapies were more successful in ameliorating stress responses in the body. Meditation was another thing. And I know I have a love hate relationship with meditation because people's understanding of what it means it's so sort of prescribed and defined that I think people are afraid to make it their own. So, I feel like those are all the therapies, but let's walk the journey of a person. A person is the first filter. So, firstly, we spoke about perceived stress. My perception, and what is his name now? Deepak Chopra. Deepak Chopra, when he studied as an oncologist, he speaks about working with his wife in a specific oncology department. And after a while, they noticed a startling a kind of experience they were both having. They were talking, and what he noticed was that there would be two similar patients coming in with a similar staging of cancer, a similar it's kind of a genetic, down to the genetic level, basically similar in all respects, age, female, sex, all of that, or gender. Yet one group would consistently do worse than the other group. And he noticed this to be a consistent thing. This is what changed, helped him change his track and focus into mind body health, because what he realized was that those people with a different expression of the stress they were facing had better outcomes. So, really, I think that the stress starts at the perception level, and how we perceive a challenge that we're going through, no matter how stressful it may be. So, reframing it, your inner belief around challenge, stress, to expect it, because it will come, some kind of challenge, we are meant to expect it. This is going more into the philosophical discussion of it, but to talk to your parents and to your patients and your clients and say, life is not without challenge. Life has ebbs and flows. And so if you are on a mountain and you accept that this is good, but this is not permanent, and if you're in a valley and you say the same, this is sad, but this is not permanent, you know that the undulation is something to expect. And I think this is also part of cognitive behavioral therapy, that you're taught to change your perception, your expectation, how you perceive the stress. I think with experience then changes. For example, if you're a business owner, your first business fails versus you're a business owner and your 57th business fails, your perception of that fail is going to be very different. So I think experience plays a huge role. your inner thoughts and your self-talk, your inner kind of beliefs around what is happening, and your self-talk, and questioning those thoughts. Are they realistic or unrealistic? You know, a lot of people think in black and white, it's all or nothing. I'm either best or worst. If I'm not what I expect, then I'm worst. Those are the things that can be challenged and taught. But really, you know, having that ability to be mindful of where we're at, where in my body, what does my body feel like when I'm stressed? All of these, there's a lot of training out there around the steps that can be taken for recognizing what is stressful, how to then adapt, how to change your breathing, how to take space. Breathing techniques have also been shown, you know, certain behavioral techniques have been shown to help. So there is a lot that we can do. The more we talk about it and normalize it, the easier it becomes to access.
Those are really, really helpful. And, it makes me think of Viktor Frankl's book, Man's Search for Meaning, where he says exactly the same thing. And it was incorporated into his type of psychology, logotherapy, where he speaks about how the people in the concentration camps, he could put them into two camps, so to speak. One would be those that chose to have hope and to see meaning or purpose in their suffering and what they would take away from it, what the outcome would be once they left. And the others that chose to give up or perceive that there was no hope, perceive that there was nothing to live for, no purpose, no meaning behind their suffering. And the difference was physical. Within 3 days, he said you could tell when someone gave up, they would die within 3 to 5 days.
That's powerful.
Versus those who did not, you knew that they would be more likely to make it out healthily. And he was one of those who chose, who worked, being all meta, and as I'm sure he was, worked on perception, chose to see things in a certain way. And I think that that's so interesting. Again, the power of our minds or of our psychology over our physical bodies is so incredibly, incredibly powerful. So I think if we do take aboard these things like mindfulness, meditation, breathing to calm our vagus nerve. I know that we've got previous lectures by Laurie Roch in our exercise modules and other modules as well, where he speaks about exercises even to activate the vagal nerve based around central movements. So you could look at those kind of things, cross-legged sitting even to activate the vagus nerve and calm yourself, go more into the parasympathetic rather than the sympathetic nervous response. And there are so many things that one can do. Additionally, making changes. I don't want to underemphasize this as well, as you actually pinpointed in the beginning of this discussion, Dr. Kajee. You made a huge change to your life when you chose to leave your academic medical practice within the hospital and go into a different form of practice and step away, as did Nadia Pataguina. I do think we need to also think about restructuring our lives because of the mindset that, as we were discussing in the beginning, that we want to achieve. We're on this treadmill. Maybe we don't have to choose that. Maybe if we're seeing serious consequences to ourselves, physically, mentally, and to those around us, maybe we need to choose to change our lives as well. So I think there are many things that we can do.
Absolutely. I think this is what to do about it is a whole textbook on its own. It's you cannot really speak to the treatment just in a few minutes. But one of the important things that I think is what I do with my clients is a wellness wheel. There's another wheel that I've created, and you need to look at your priorities, and then you have to figure out what in life is your priority. That in itself is a journey to figure out what is important to you and what it isn't. You could work with a coach for this. You could work with a somatic therapist or some kind of counselor, but you need to find out what is your priority and then kind of undo the ropes that tether you to the things that are not your priority. You may need to learn to say no. People have difficulty doing that. And then it's about clearing your life of those things that no longer serve you with love, not with hate or resentment. Clearing resentment from the past, forgiving things that happened in childhood that may take a lot of work and trauma therapy. Clearing your home from too much clutter, clearing your desk, clearing your mind. Then there's something about too much, too little. What do I have too much of? What do I have not enough of? And it's about coming back to homeostasis, trying to slowly bring yourself back to balance. But that is a stepwise approach. There are emergency mechanisms that can help you in the moment, like learning to increase the space between the trigger and the response. And the breathing can help you, but that in itself is a textbook on how to do that. These are all huge topics, and I think it underpins the importance of striving for a relationship with yourself, striving to not to get too philosophical, but again, it starts from childhood, where your child says, I don't want to eat egg because it makes me gag, and you say you will eat the egg because it's good for you, and you oppose that, and you teach your child to divorce the sensations in their body. It's a knock-on approach to, I feel this, I know it feels traumatic, but I ignore it because mom told me it's not important, that's more important. It starts really early. Get to know yourself. We need to start again in our homes with ourselves. And I think it's only then that we will start to slowly turn the dial back.
Absolutely. So, where can people go to find out more about these techniques? Automatically, top of mind is Nutrition Network has got a training on resilience and stress. So, please
Yeah.
go and do that training where you will learn more techniques, such as the ones that Dr. Kajee has been mentioning today during this discussion. Dr. Kajee, have you got any other suggestions of places where the listeners can go to learn stress mitigating techniques, books they can read, other resources?
Gosh, I have a range of books and I am not best at remembering their titles, but really you can just Google mindfulness techniques. You could download certain meditation apps. It really is a very personal journey. It's a journey, like, for example, Tony Robbins says, people told him to meditate. He says, I can't meditate. I can't sit still. So he has to honor his body. His meditation is the walk that he does or the movement that he does every morning. So you can do a meditative sort of walk. Laurie Roche talks about the cross body crossing over, which rewires the central nervous system. I would read about, depending on your level of trauma, somatic based therapies I have found have been incredibly useful. EMDR, I think, is also very powerful tool that if you go to the right practitioner can be very helpful. Reading about triggers, finding out about what triggers you, and then just taking a response to say, when you're triggered, I am feeling triggered right now. And something I want to say is, we use that term trigger so loosely. A trigger is a personal psychological pull. A trigger, if you close one person up in a little claustrophobic cupboard, and that happened to them when they were a toddler, and their brother or sister locked them in a cupboard, and they had a huge trauma response. Having a door closed in their face is going to be a massive psychological trigger. Their perception of that is, I'm dying. So please, let's start using the word trigger with more respect and responsibility, so that we can start to embrace it as something with compassion, rather than something that is, a label, negative. Ah, you're triggered, she's triggered, he's triggered. It's actually much deeper. This is a huge topic and I could talk about it for ages. Yeah, there's so
Yeah.
much more to say.
Absolutely, but I think you've given all of our listeners a great place to start digging. You've given them kind of the flags to go to and look into more. So please, all the listeners, go think about what it is that you're going to start with. Are you going to start with the breathing techniques? Maybe go and look those up. Are you going to start with the meditation? Are you going to start with the nature walks? What are you going to start with? Also, we didn't mention diet much in this
Mhm.
chat, but I do want to emphasize that when you eat correctly, you're going to increase your resilience. You're going
Absolutely.
to optimize your mitochondria and your ability to cope with and deal with stress so that you're less likely to perceive it as severely or as negatively as you might otherwise do. But there are so many things. Exercise, we didn't even go into. Changing your life.
Exercise
So
is the
many things.
polypill.
Yeah,
Exercise is the treatment for everything. So exercise is
absolutely.
my number one. I can't believe I didn't mention it. Exercise is the number one treatment for before you want to talk to anyone. Get outside, walk, run, lift weights, do something. Join a running club. You don't have to talk to anyone. Yeah, exercise for me is number one, two, three, four, and five.
Wow, well, that's a powerful statement, Dr. Kajee. Thank you so much. We have already been chatting for an hour, so we're going to have to close here. As much as I think we both would and our audience would love to keep hearing everything you have to say about this discussion and diving into it in more depth. Dr. Kajee, thank you so, so, so much for all of your time, all of your expertise, sharing it so openly and empathetically and compassionately with all of us. It's incredibly valuable. Thank you. Thank you.
Thank you so much
And
for your kind words, Tamsin, and thank you for to everyone for your attention.
yes, to our audience, it's always so wonderful to see you, to have your comments, to have your questions. Thank you for engaging with us as well. Yes, so now I really hope that all of you are thinking about how and why stress affects you, why it affects the heart, how to spot the warning signs, and simple steps that you can take to make a real difference. And those simple steps can become quite complicated steps, but you always can start simple. And then if you want to find out more about the heart, more about the cardiovascular system, the cardiovascular health training is exceptional. It is a huge training where we dive into, there are 3 lectures just on assessing cardiovascular risk. If we include the one by Siobhan Huggins on lipoprotein little a alone, then let's make that 4 lectures where you're looking at labs, we're looking at imaging techniques, what's the pros and cons of the different ones, how can you do it, what's cost risk benefit ratios for these things. Are there other things you can look at? We talk about stress, with Dr. Kajee. We speak about techniques, coping techniques. We speak about rehabilitation after cardiovascular incidents. There are so many things. So please just follow the link in the comments section. Have a look at the training. And if you sign up before Wednesday next week, you will get 30% off. So this is your time to sign up. Please do sign up in our space. When it comes to low carb, high fat diets, this is still the most contentious subject:
Mhm.
cardiovascular disease and cardiovascular health. So if you really want to dive deep into the literature, find out when it's okay, when it's not okay, what fat really does, what cholesterol really does, all those things, please, please, please join us in this training. Thank you to our audience. Thank you, Dr. Kajee, and we hope to see you in the training, everybody. Bye.
Bye bye.